Hello. Hi. Nice to meet you. Have a seat, please. My name is Infinity, and how can I help you today here at the clinic? Yeah, absolutely. You can register. Yeah. Are you ready to spend a bit of time with me just to go through all the details and register? Yeah, great. Did you manage to fill out a form when you came in? That's absolutely fine. We can do that together. Just grab the right form here. Okay. So today we're going to have a look at your insurance details, fill out this form, and once I'm confirmed that everything is good, I'm going to ask you to proceed to another room and meet one of our nurses there who's going to do just a regular checkup for you. Okay? Perfect. Are you registering just yourself today, or is there someone else that needs to be part of this plan as well and register in our clinic? Just yourself. Fine. Do you already have health insurance? Okay. So let's have a look at that first. What's your postcode? Okay. And when did you roughly register for your health insurance? Okay. And today is Okay. Okay, and what's your date of birth? All right. And do you smoke? No. Great. Let's have a look here. What's the issue? Ah, I entered the year wrong. Happens. Okay, so I'm just going to try and check whether your health insurance does in fact work with our clinic. Okay. And what kind of plan do you have? Is it a medical plan or a dental only plan? A medical plan, okay? And okay. Does your plan offer a health savings account? No, that's fine. And is your plan part of the asthma care program, the diabetes care program, the fitness discount, healthy pregnancy program, high blood pressure program, quit tobacco or weight loss program? No. Would you like to potentially enroll in one of those through us? Yeah, which one? Okay. And do you know if you have the bronze, silver, gold, or platinum coverage? Okay. And what's your current deductible? Okay. Let's have a look here. Alright. So, are you with Blue Cross Blue Shield, Medica, or Health Partners? Okay. Yeah, I can see here that you are covered with Health Partners. So that's your coverage plan. Okay, perfect. Good. Fine. And the silver. Alright. So now that I have your health insurance provider, let's get your details, please. So I know your first name. How do you spell your last name? Okay, and you've told me your date of birth just now, which makes you... Okay, you look great. Yeah. Alright, today's date. Okay, and the form is completed by me. So I'm going to ask you some medical questions and some general medically related questions. Some of them may be repetitive. That's because I need to do 2 separate forms, one for us, one for your health insurance provider. So bear with me if I forget the answer that you've given me to the same question 5 minutes before, okay? Okay, so in terms of your personal habits, which are smoking, diet, alcohol use, have you had any change to those recently? No change. And you said you don't smoke. What about alcohol or diet? Okay. Are you currently exercising at least 3 times a week? What do you do? Brilliant. It's very impressive. Well done. Do you have any allergies? Okay. To what? And, okay. Any particular flowers? Lilies. Alright. Do you take any regular medication? Good. Do you have any significant illnesses since your last physical exam? Yeah? Okay, we can have a look at that for you. Have there been any changes to your medical history, your family medical history? Any new developments? Anybody in your family? No? Good. Have there been any significant changes in your work, home, or family environment? Yes? New job? Congratulations. When was that? And how are you finding it? Okay. Great. This part of the questionnaire can take a little while, and I'm sorry if I bring up anything that is less pleasant to think about. Just part of what we need to do here to ensure that we have all the information, just the standard questionnaire. Okay? So let's get started. With everything that I bring up and ask, just indicate if it's a yes or a no for me, okay? Okay. Do you feel like you have had good health lately? Good. Has there been a recent significant weight change? Good. Any unusual fatigue or weakness? Any frequent headaches? Okay. We can look into that for you. Any changes in vision? Blurred or double vision? Eye disease or injury? Do you wear glasses or contact lenses? You would like to? Okay. We can arrange an eye exam for you another time. No problem. Okay. I'm going to move on to questions related to your ears, nose, mouth, throat, and neck. Do you wear hearing aids? Do you have any hearing loss or ringing in your ears? Any earaches or drainage? How about chronic sinus problems or runny nose? Nosebleeds? Yeah. How often? About once a month. Okay. Any mouth sores? Yeah. What kind? Okay. Bleeding gums? Okay. Sore throat or hoarseness or voice change? Okay. Any lumps or swelling glands in your neck? Not that you know of. Okay. How about difficulty swallowing? Just on a day-to-day basis. Good. Any neck pain or stiffness? Yeah? How severe? From 1 to 10. Okay, a 4. What do you think that's due to? Okay, I can check that out for you. Okay, let's move on to your cardiovascular symptoms or conditions. Have you had or do you have any heart trouble? How about chest pain or angina pectoris? Palpitations? Any shortness of breath with walking or lying flat? How about swelling in your feet, ankles, or your hands? Any issues waking up at night with shortness of breath? Brilliant. Next to your respiratory system, do you have a chronic or frequent cough? Coughing or spitting up blood? How about shortness of breath? Asthma or recurring wheezing? No? Perfect. Okay, now on to some gastrointestinal questions. Intestinal, oh my goodness. It's been a long day. If you experience any loss of appetite, changes in your bowel movements? Okay, what kind? Okay. Any nausea or vomiting? Good. How about painful bowel movements or constipation? Frequent diarrhea? How about blood in your stool? Stomach or abdominal pains or heartburn? Yeah? Okay. Which one? Heartburn. Alright. How about black or tarry stools? Okay. Last is our genitourinary questions. Tend to be our favorite ones to get answers to. Sorry about that. It's part of the job. Any frequent urination? Burning or pain? Change in force or strain? Inconsistencies or dribbling? Any pain? Good. Any other irregularities? Lovely. Great. Perfect. Okay. A few more to answer, I'm afraid. Alright. Any joint pain for you? Joint stiffness, swelling, or warmth? Nothing you've noticed. Good. Weakness in muscles or joints? How about muscle pain or recurring cramps? Back pain? Okay. Cold hands or cold feet? More than normal? No. Difficulty in walking? Good. Any rashes or itching on your skin? Change in color or any moles? No. Good. Changes in hair or nails? Bit of hair loss, okay? Varicose veins anywhere? Okay. Any lumps, pain, discharge, or rashes in your chest area? Perfect. Okay. Some questions about neurological symptoms are next. Any frequent, recurring, or increasing headaches for you? Any lightheadedness or dizziness? How about convulsions, seizures, or spasms? Numbness or tingling? Any tremors? Paralysis? Stroke or head injury? Okay. Have you had any memory loss or confusion? Nervousness? Insomnia? Yeah? Okay. Any depression? Alright. Next is our endocrine system. It's to do with your hormones. Yeah. Okay, any glandular or hormone problems? Any heat or cold intolerance? Excess skin dryness? Excessive thirst or urination? How about change in hand or glove size? Okay. Any issues with being slow to heal after cuts or wounds? Bleeding or bruising? Recurrent anemia? How about swelling, warmth, or tenderness of veins, or history of any vein issues? Good. One more section. Have you had a history of skin reaction or other adverse reactions to any kind of medication, any sort of plants, or any kind of materials other than lilies, which we've already talked about? Yeah? Okay. Okay. Penicillin or other antibiotics? Yes, you've already told me that. What was your reaction to that? So what happened? Okay. And a rash? Okay. Any reactions to morphine, Demerol, or other narcotics? Okay. Novocaine? Any anesthetic issues? No. Okay. Any issues to aspirin? Okay, what was that? Also a rash. Was that topically applied? Okay. Any issues with tetanus or other serums? Iodine? Any other medication or food allergies that we haven't talked about? Perfect. So if you could sign here for me, please. Yeah, thank you. Great. Thanks very much. And I'm just going to date this. Just put your name on it. Perfect. So I'm going to take this over to our GP, and she's going to have a look through this and review your systems and symptoms. Also, she'll only contact you if you actually need to be seen. So if there's anything of concern here, otherwise we'll cover any of the related questions in your nurse visit. So the nurse will see you, and she's going to just do your regular tests, have a look at you, take your blood pressure, take your pulse, just have a look all over really and make sure that there's no apparent need for any treatment. Usually that's totally fine, and we'll leave you alone until you need an appointment or we call you in for your annual exam. If there's anything on here that the doctor would like to review with you, we will give you a call and let you know, and then you can come in to see the doctor on a separate occasion. Okay? Great. Other than what we've discussed today, is there anything of concern that you'd like to talk about with the doctor? Should I make an appointment for you? Okay. Yeah. And when did that start? All right. And just make a note here for our doctor when she reviews this. To be seen about recent changes to. Okay, so alright, that's fine. And like I said, we can also schedule an exam for your eyesight another time with one of our optician partners, and we can get you sorted out in terms of any glasses or lenses that you'd like. Yeah. Okay, so let me make an appointment for you in our system. And just get on here. Oh my goodness, I always have constant issues putting in my password. Okay, so we want to book you in for a general appointment. Since it's your first time, it's going to last half an hour. Okay? other than that, they're 10 minutes. Yeah. Unless you need more time, then we can, always chat with me and I can book you in for 2 appointments in a row if need be, okay? So, what's your usual availability? Morning, afternoon, evening? Okay, before and after work, I see. So tomorrow is going to be a bit tricky. How are you looking for the day after tomorrow? No? Following day? Okay. Yeah, we work 7 days a week. Okay. Let's see here. Okay, so I have... Okay, so I have 8:45 for you in the morning. Otherwise, in the afternoon, I have 5:30, and I have 6:15 and 7:15. Any of those any good? Okay. Let me just make sure I got your name spelled right here. Yeah. Okay. And it will be in the building across the road, okay? If you look behind you, yeah, just over there. Yeah, exactly there. So just come here to reception first. I'll see you and I'll book you in or check you in. And then afterwards, you can go ahead and see the doctor across the street, okay? Just in case one of my colleagues is here when you come in and you haven't been before. How would you like to be contacted about appointments? We have SMS, email, or phone call. All of the above. Perfect. And can I have your phone number, please? And your email address? Is that with an O? A U. Okay. .com. Do you have an emergency contact that we can have in the system? So this can be a friend or a family member. Sure. Can you spell that out for me? And what's the relationship? Okay. Could you give me the address for this person, please? Street, road. And postcode? Great. And an email address as well, just in case. Perfect. Alright, so your appointment is at 7:15 on the 26th with Dr. Johnson. She's going to see you for 30 minutes, it's your first appointment. And we're going to send you a confirmation right away via email, and then you'll also receive an alert via SMS, email, a day before, and we'll give you a phone call in the morning just to remind you. Okay? Perfect. Well, it's brilliant to have you as part of our clinic. Very, very happy to have you here as one of our patients. And of course, we hope that we won't see you again, but in case we do, we're very happy to do so. Please give us a call with any concerns whatsoever, or if you remember anything that we didn't cover today, I can add it to your file. And I'm going to take you through and see our nurse now, so if you're okay to just wait over there just for a few minutes, I'm going to finish entering this into the system, and I'll take you straight through. Okay, great. I'm just getting your patient number and then we'll be straight through. So, sorry about the wait. Okay. Great, so we're all ready and we can go see the nurse now. So just follow me and we'll go see who's available and we'll pop you into the first room that's free. Let's go.